All right. Hi, everybody. Dr. Rafich here, board certified surgeon, owner of Vet Triage, our third live stream. Yay. And yeah, so we'll talk about a general discussion on allergies in dogs. This is a very common condition, so I figured it's a good one to start off with. And I'm sure in future live streams, when we have more of an audience, this will come up repeatedly. Probably, it's such a common condition. Dermatologic diseases in general makes top three in veterinary medicine, probably top two, probably right behind gastrointestinal disease as far as most common conditions that animals show up to the vet for. But at any rate, let's talk about allergies. So, allergies in dogs should be thought of as two different categories, either dietary or seasonal. And there's a third category, which it could be both. Dietary allergies implies that there's something about the dog's diet that is causing an immune response that manifests itself as allergies. And the component of a diet that causes allergies in dogs is the protein. It's the protein content. So most dogs have exposure to chicken, beef, or both in their diet, especially if you're feeding your dog commercially available diets. And over time, for some reason, due to multiple factors, not least of which is genetics, the dog's immune system no longer tolerates that protein. The immune system sees that protein as foreign and reacts in a way that is that we see as an allergy. So dry skin, itchy skin, red eyes, flaky neck, dandruff, things like that. And so that's dietary allergies. The seasonal allergies are due to environmental causes, and probably more apt to describe it as just being environmental instead of seasonal. But regardless, most people look at it as seasonal because pet owners that think their dog has an environmental allergy see a seasonal component to it most often. But in any case, there's an allergen in the air that is causing the dog's symptoms. You can't tell just from looking at the dog whether or not your pet has seasonal versus dietary allergies. They manifest the same way, but environmental allergies are anything in the environment that can cause allergies. So pollen, grasses, molds, things like that. And environmental could be anything from something in your home to something actually outside. And just like how dietary can have more than one protein source that's causing the issue, environmental allergies, you can have more than one causative agent that is setting off the allergies. And oftentimes there are numerous environmental allergies when you test these dogs. So that's how allergies should be thought of. And of course, you could have dogs that could have both conditions, both dietary and environmental. So then the question is, well, how do you figure out between the two things? Ideally, you would work with a dermatologist, a veterinary dermatologist. And for those who don't know, yes, they do exist. There are specialists. The same way I'm a board certified veterinary surgeon, there are board certified veterinary dermatologists, and there's not as many of them as there are surgeons, but you can Google search or go to the veterinary dermatology website, and it'll probably help you locate it. Anyway, when you go to the dermatologist, you'll end up recommending testing. Now, as far as I know, the two most common tests to look for environmental allergies, we'll start with that one first, is either a blood test, which is takes a bit longer to receive the results, maybe a couple of weeks or something. It's a bit on the pricey side, and maybe less accurate, but it's a blood test, and then the report will come back from the lab once the blood test is run, and it'll tell you all the things that they tested your dog's bloodstream, and they'll tell you where there's a reaction, meaning an allergic reaction, and where there isn't. The second test you can perform on your dog to test for environmental allergies is a skin test. And so the skin test is one where under sedation, they shave a large part of your dog's fur, and like a grid, they inject a tiny amount of the allergen in a grid-like fashion. and then the dermatologist will observe the reaction and determine from there whether there's no reaction, mild, moderate, or severe, something like that. It's very subjective, unfortunately, and they'll document which allergens they injected in your dog is causing a local reaction. It's not dangerous from the standpoint of causing a systemic reaction, although it could, but it's a very small amount of allergen just to see a focal irritation. It's similar to a mosquito bite in people. You get this hive, this wheal. It's raised bump. That's a little bit itchy. And the good thing about that test is that it's much more accurate because you're literally testing the dog's immune system there in real time with the actual allergen. Downfall is it's probably pricey. I don't know the cost, but it's not an easy procedure. Requires sedation. It takes a while for the dermatologist to perform it. There is, like I said, a certain level of subjectivity to it. So whereas the blood test is very objective, allergy or no allergy, there's no room for interpretation there. It depends on the dermatologist. Is that a mild reaction or a moderate reaction? So there's subjectivity there to it. And of course, it's a bit more cumbersome test. It's not as simple as just a blood test. Just draw the blood, submit it. This is a lot more work involved to get this done. And then, but the end goal is the same. So you document what your dog is allergic to in the environment, and then the dermatologist will submit the results to a lab that's going to make a vaccine for your dog. That vaccine will administer to your dog in some scheduled fashion. And you're looking at probably at least a year, maybe years of this, maybe lifelong. I don't really know long term, but your dermatologist will talk to you about that. So that's how environmental allergies are tested for and how they are typically managed. Because you can't really change dog's environment. You're not going to move to a different state. At least most people won't. And there's no way to avoid things like dust or mold or whatever. So then, as far as dietary, it's a bit easier but also a bit tricky. So the way to test for dietary allergies is you pick a protein that your dog has never been exposed to, and so usually not chicken and not beef. You want something else, and that novel protein is the only protein your dog can eat for X number of days, weeks, months. Typically 8 weeks is the minimum to do this dietary trial for. And so you pick a protein that they've never experienced before. You give them only that protein for 8 weeks, and you see what the response is. Does the dog's symptoms go away or not? Now, here's the deal. They only can eat that protein. So if your dog hunts, mice and rabbits and stuff, you can't have that anymore. If your dog receives medication and it's flavored, like beef flavored or chicken flavored, or supplements that they receive that are flavored, you can no longer have that anymore. You have to make sure that if you have kids, that they're not feeding the dog things behind your back, or food when it falls on the floor, the dog doesn't get it. The whole family has to be part of this. There's no cheating. They can't. There's no cheat days. They have to receive only that diet specifically, consistently for 8 weeks minimum. And so you're looking for diets that are like duck, venison, rabbit, squirrel, fish based diets. And that's what we mean by when we say novel protein diets. A novel protein is a protein that your dog's never experienced before. It's novel to his immune system. So that's how we figure out dietary allergies. So it takes a while. It's a bit more crude, let's say. And, diets are expensive. And if you're getting novel protein diets, maybe paying more for those diets. It also takes dedication because you have to watch your dog still be itchy and have allergies while you're trying this novel protein trial out. So that's how you figure it out and go from there. Now, again, everything that I'm saying up to this point is at the mercy of a veterinary dermatologist. They are specialists in this. They also are the ones who are involved with knowing the most up-to-date research for it as well. So keep that in mind too. But in general, this is a good starting point. Most people are confused by allergies. There are lots of veterinarians that are confused by allergies, and it really is a simple concept, and that's how we look at it. Now, we're not going to go over other treatments because obviously there's a myriad of treatments that are out there that are more palliative, meaning symptomatic treatments. So let's say you can't afford the blood test or the skin test or your lifestyle is not conducive to doing a novel protein diet trial, and your dog is clearly suffering, just constantly just itchy redness and skin infections, just a miserable life, then there are medications. Some are administered as injections, some are pills you give at home and some are over the counter to try and alleviate your dog's clinical signs. And so for that, we have to tailor that to your dog. So I would say if that's a starting point for you, or if you just have questions about allergies in general, or if you want to know more about this stuff, vettriage.com, of course, shameless plug. You're going to go to my website and create an account, pay, and you'll be on with a doctor in less than 2 minutes. And the doctors we have on there are, of course, seasoned veterinarians who are well versed in the ways of skin conditions, especially allergies, because it's so common. And that's how, And so then from there, they will tailor the treatment for your dog, while going over kind of the ideal way of handling this, which would be with testing, and all that, like I just mentioned. So the prognosis for allergies in dogs depends. There are some that respond beautifully to the treatment or treatments. There are some that just have a bear of a time trying to get them under control. It's a tough one, and genetics is probably the biggest cause of this. There's certainly breeds that we see that are more prone to allergies. Like your pit bulls especially are common, and small white dogs. But any dog can get allergies. The most common age too for allergies, they're adults, they're young adults, maybe 3 to 5 years of age, somewhere around there, 3 or 4 years old. So it's rare to see a dog at 6 months old have allergies, although it can happen. And it's also rare for a dog that's like 10, 12 years old to get allergies, although it can happen. But most of the time, they're going to be in the younger group, young adult group. So I am always skeptical of a diagnosis of allergies in a dog that's like really young or really old, especially if testing hasn't been done to confirm it, because there are other causes that could mimic. There are other causes of skin or systemic disease that can mimic allergies. And so, although allergies are most common and most likely and all that, you want to still make sure that those symptoms that you're seeing are not actually caused by some other disease, obviously, because then you can't tailor treatment, or you're going to start treatment on a condition that's never meant to respond to it. So you want to make sure that you know what you're doing. But it's all within the context of your own desires as a pet owner and what it is you're looking for financially, what you can afford financially. So that probably makes it for this video. Hopefully we'll have an audience in the next upcoming, who knows, days, weeks, months, years for these live streams. But check out my video on YouTube as well that goes into allergies a bit more as well. But this is kind of the short of it on how to discuss how to think about allergies in dogs. And yeah, I'll see you in the next one. Please support the channel, donate, subscribe, hit like, do all the things. And I will try to be on again tomorrow, June 6th. So thanks again for everybody who was watching this in the playback, and we'll see you in the next one. Take care.